Hello, my name is Ogechi Yvonne Walisi, a postgraduate of mental health nurse practitioner with Herzing University. I'm going to be presenting my speech on public health legislation, the Compassionate Care Act of North Carolina. One of the most current legislation that I have had a great interest in since it was introduced to the Senate is the Senate Bill 711 of North Carolina that would enact the Compassionate Care Act. There are many controversies related to this legislation, and debates have erupted over the past few months on whether this legislation should be passed or not. The bill is being sponsored by Senator Bill Rabel, Senator Michael Lee, and Senator Paul Lowe, who are pushing for its implementation in North Carolina. The Compassionate Care Act will allow people who have debilitating medical conditions to apply to use and access medical cannabis through a regulated medical cannabis supply scheme. Therefore, for this week's assignment, I will research the Compassionate Care Act of North Carolina, summarize the legislation, give my position, and call for action. Summary of the legislation. The Compassionate Care Act is legislation meant to legalize cannabis in North Carolina for medical use only. People who will be permitted to use and access medical cannabis will be required to obtain a registry identification card from the North Carolina Department of Health and Human Services. To apply for this certificate, patients are required to present certification from a registered physician stating the potential health benefits that medical cannabis will have on the stated individual, which are likely to outweigh the risk posed by cannabis to the patients, together with an application form. Moreover, patients who are under the age of 18 years will only qualify for medical cannabis if their parents give consent and if they acquire the medical cannabis for their children and control the dosage prescribed. Another important aspect that is stated in this legislation is the list of diseases that will qualify for medical cannabis. So for children less than 18 years, they need a consent from their parents, and it's going to be under their parents' care. They're not just going to give it to the children. Among the conditions that are stated are Parkinson's disease, Cohesia or wasting syndrome, post-traumatic stress disorder, epilepsy, multiple sclerosis, acquired immune deficiency syndrome, sickle cell anemia, Crohn's disease, amyotrophic lateral sclerosis, severe or persistent nausea that renders the patient bedridden, terminally ill and reduces life expectancy to less than 6 months, and any other medical condition which will be approved by the Medical Cannabis Advisory Board. Concerns raised about the legislation. Influential people in North Carolina, such as Senator Joyce Crowley, are against this legislation, where they state that Senate Bill 711 will result in the legislation of marijuana in North Carolina will result in the legalization of marijuana in North Carolina by the year 2024. Since the license fee for the vendors is low, Senator Joyce argued that people should not be allowed to sell their licenses, and the prospective profits that the vendors could get from marijuana should be reduced to bare minimum. Another concern that was raised is that if the law is to pass, marijuana should be made available in non-smokable forms and non-inhalable forms to prevent the negative effect of carcinogens similar to those that affect tobacco users. Moreover, a religious official from North Carolina raised a concern that the bill was going to make a product that has potential harm to look like something good, which will lead to youth indulging in drug abuse of marijuana and the ultimate legalization of recreational marijuana. Counter-arguments to the raised concerns. In response to the concerns raised above, the Senate Bill 711 has several clauses that address each of the raised concerns. Firstly, any person who wants to be a supplier must comply with all the legal requirements of the North Carolina Compassionate Care Act, where not everyone is allowed to grow marijuana, where people with criminal records are exempted, and out-of-state residents. Obtaining licenses for distribution will decrease the chances of people supplying marijuana for recreational use. Secondly, the government has ensured that marijuana's profitability is little enough not to be attractive to potential businessmen, where there is a 10% tax on marijuana, which totals to twice the state pays base sale tax on all marijuana products. In addition, dispensaries that will be granted permission to dispense medical marijuana will be required to pay $50,000 or more to obtain a license for sale and medical prescription of marijuana. Thereafter, the dispensaries and clinics will be required to pay $10,000 every year to retain their licenses. Thirdly, marijuana can be prescribed in any form apart from inhalable or smoking. These other forms include edibles, vapes, oils, sprays, tinctures, patches, and suppositories. However, a patient is given smoking marijuana. There is a clause that prohibits patients from smoking or vaping medical marijuana in public places or open spaces, work environments, inside vehicles, within churches, in school, and child care facilities. These are the places they are not able to smoke medical marijuana if approved. Any individuals who violate this law would be punished with a fine of not more than $25. Last but not least, advertisements for marijuana will be highly restricted. Any advertisement of marijuana in pictures or animation is prohibited in the bill. Stores or even dispensaries are not allowed to advertise marijuana in form of any drawings, such as leaves or any other signs. No advertisements. These regulations will ensure that recreational marijuana is not legalized and that the youth do not embrace taking recreational marijuana. My position on Senate Bill 711. After having gone through the North Carolina Compassionate Act, Bill of 711, I, as a person, I believe that the bill should be passed because I feel like its benefits outweighs its disadvantages. And if the regulations are complied with in accordance with the law, the disadvantages of medical marijuana can be averted. Based on a research that was conducted by American Alliance for Medical Cannabis, they linked medical cannabis to a lot of health benefits that help with to lower blood sugar, enhancement of blood circulation, lowering of blood pressure, and most importantly, they established a link of medical cannabis with the fighting of cancer cells. This is a big one. Some people believe that marijuana is not good for our health because of how high that people get when they take it. So true. However, there is a difference that exists between recreational cannabis and medical cannabis concerning cannabidiol and tetrahydrocannabidiol, which is the CBD and the THC compounds found in marijuana. Recreational cannabis contains high THC level and low CBD, which mostly lead to the patient being high, while medical cannabis contains high CBD and low THC. CBD is a compound that relieves a person's pain and makes them calm, while THC has the characteristics, effects of making a person high. This is a big difference. Based on this research, I believe the medical marijuana should be made law in North Carolina due to its numerous medicinal value and the number of people that it could potentially heal and save lives. Public health legislation is meant to improve people's health and their quality of life, and medical cannabis has the potential to do so. However, all the stakeholders involved, together with the police, should be very vigilant to ensure that all regulations of this act are complied with, to ensure that people do not end up using cannabis for recreational purposes, which might lead to a drug addiction and a series of other negative effects that arise from the use of recreational marijuana. Call for action. The Compassionate Care Act of North Carolina aims to legalize medical marijuana, where patients with a listed illness would be allowed to get prescription for medical marijuana from licensed physicians only. Although there are many concerns raised by the people in regards to the misuse of medical marijuana and the eventual legalization of recreational marijuana, Senate Bill 711 has several clauses that are meant to ensure that these concerns do not become a reality. An overwhelming majority of North Carolina strongly support the Compassionate Care Act, and so do I. This bill will ensure that those suffering from the most debilitating illness have access to the safe and responsible use of medical marijuana. Currently, several states have already adopted their marijuana laws, and others are in the process of legalizing medical marijuana. I encourage everyone to read, to research, and to support this bill because it serves a good cause. We should overlook the politics behind the bill and consider the science behind it. Handcuffing medical doctors from making the best decision while treating their patients is wrong and illegal. Therefore, I urge all North Carolinians to contact their legislators and urge them to vote for the North Carolina Compassionate Care Act. Together, we can make the world a better place. Thank you.